Thanks once again for having me here, Dr. Pollack and the other organizers. It's really an honor to be here, and very stimulating bunch of discussions we've already had. So I have a bit of a surgical bias, I'll admit, but I was thinking about it. At least 60% probably my time is spent on non-surgical stuff, so there's a lot of overlap. And so I mainly want to talk about brow aesthetics and then how I like to approach revolumization for long-term effects with fat transfer. So I've written a little bit about it. I mostly enjoy talking and sharing ideas with people. This is a pretty typical patient that comes into our office and is looking for rejuvenation. And I just want to focus mainly on the brow for right now and how there's a loss of volume beneath the brow, a loss of a highlight. She's got a bit of a highlight over here, but it doesn't extend over immediately. And so what I feel like you tend to see is the loss of volume tends to begin immediately, whether that's because of the supratrochlear and supraorbital vasculature that comes out here. I don't know that anybody's ever proven that, but it does seem to begin immediately and migrate laterally, and so there can be a little bit more of a need immediately in earlier age, and of course volume loss in the mid face and lower face as well. So what is the ideal youthful brow? The height is not necessarily high, but it is characterized by a lot of volume beneath the brow. So the highlight beneath the brow. The distance here between his lash line and his brow is less than that of the vertical height of his eye, so that's kind of a measure we can go by, I suppose. But certainly low on this side as well. Arches, of course, somewhat gender dependent, but a low brow is not necessarily an aged appearance. In fact, if you look at this mother-daughter combination, the daughter has a lower brow than the mother. You might argue that this is a little more of a model-esque arch. I would agree with you, and certainly in cover magazines you tend to see that. But look at the depth, I guess, of the medial brow, but it's characterized by a highlight beneath it. So one of my favorite figures, just showing the same patient, aged and more youthful, and again, highlight beneath the brow. She's actually already lost some volume in here, but nonetheless, much more than has more volume than on this side, the more aged side. The brow descent, though, is not that much, and I would argue you could almost elevate that just by volume restoration. And I have a patient that we'll show that with as well. So the tail of the brow may descend more, and I think that's partially, and I think some people have talked about this, filling the temple to get lateral brow lift. So that's exciting. You can do that just in the office without anything more than topical anesthesia in the lidocaine mixed with the fillers. So following another person through the years, and you see that her brow began pretty low, and it looks like she actually had a brow lift, which with the hollow here might look, I don't know, maybe passable okay, but to me, it's artificially elevated, and this hollow is the only thing that makes it maybe closely passable relative to a more youthful brow. And I think what a lot of guys, particularly brow lift surgeons, tend to fall victim to is sort of an optical illusion that occurs when you have a shadow beneath the brow that makes it look like less vertical height. And so lifting this moves the brow to a position where there is highlight below it. But if you were to fill this volume in, her brow would look quite elevated. So guys, of course, we probably all know that the brow tends to be a little bit lower. It's not arched, but it certainly doesn't depress very much with age. And he might have had an upper lid blepharoplasty, but regardless, the brow has stayed pretty stable. Of course, the volume loss in the mid-face that quite a few people talk. Again, back to her, we talked earlier about the loss of volume out there, and this is what we did, and I like that. I think it looks good. She can't stop smiling, so that's why I use the smiling view. I realize that elevates the cheeks artificially. She doesn't look quite that full when she's not smiling, but anyway, the point is highlight beneath the brow. I didn't actually lift the brow yet surgically, aside from filling in this area. So, you get some radial elevation, and I like that. So,
how much material would you use?
I'm glad you asked. So about a cc medially or two. I think more and more evenly dividing, like 1.5 of. That's just fat. That's a fair amount. The guys that I train with will talk about half cc, 1 cc, starting pretty conservatively. So But this is with total 3 cc's in the brow and 3 in the tear trough area. So we expect typically about 40 to, in my hands anyway, about 40 to 70% is what is often cited retention of the fat that you put in there. So I guess if you want to compare that to HA fillers, half that, so 1.5 cc's. And is that comparable to what you guys would typically use in the subbrow area, like a cc and a half per side, do you think?
Yeah.
I think it's a great result. But do either you guys use fat? Do you use fat? You like fat?
Not as much, so with all these
Keep
body
going, yeah.
mass
Sorry.
injections,
So it's okay.
My other talk.
Okay. So
only after liposuction.
Yeah, right.
So.
So just focusing on the brow area. And this is a year out.
The brow's
Does it
fat.
last? What's that?
It's not nice. That's really nice.
Yeah,
to get rid of all of
and
them.
one of my dermatology friends did the resurfacing. I did not do. I can't take credit for that.
Mhm.
4 years afterwards. So does it last? I mean, those of us who do a fair amount of fat, I think, can attest to the fact that it does last. This is one of the better results in lips I've gotten with fat. I mean, to me anyway. And it takes a fair amount more in the lips. Why? I don't know. More vasculature, but more in the lips. So instead of doing 2 to 1, you can do like 3 to 1 as far as what you would use relative to an HA filler. This was she had lower bleph, volume restoration here, volume restoration here. No upper lid bleph, but yet less. I mean, she's got a brow a little bit more elevated, but less skin and less pretarsal skin show, less excess skin fold in that area, and a little bit more highlight beneath the brow. What I like about this one is that people frequently think that she had a mini lift or a facelift, but just by filling in the prejowl area and actually the lateral mandible, it creates straightening of the jawline. So what's the right age? This patient is in her maybe early 30s and otherwise attractive, but does have some volume loss in the cheeks and the face. So a little bit in her, and she's one of the fortunate ones that didn't have much bruising, but that's one of the downsides with fat, and I look forward to trying more and more to decrease the downtime of fat transfer, because 2 weeks is sometimes a challenge for patients. But she was lucky that at about a week, I mean, if everybody was like this at a week, I'd be I'd much happier with the downtime. But you can tell she's swollen, a little bit bruised. But how do we do it? The way I was taught and the way I continue to do it, because I haven't found good enough evidence to change it. Hopefully that'll change today. But gentle aspiration of the fat with 10 cc syringe. I'm not using liposuction, just the way I was taught, and it works. With a 3 millimeter cannula, centrifuge over 2,000 RPMs at 2,000 RPMs for 2 minutes. Discard the infranatant and supranatant, keep the nice yellow fat in the middle there. Use 0.9 and 1.2 millimeter cannulas, mostly the 0.9, and of course multiple passes, multiple planes to try to increase viability, vascular ingrowth, and the like. So, in summary, fat transfer, it's pretty inexpensive equipment. I found pretty high satisfaction for the patients who understand it and appreciate the fact that it may require a touch-up at a year. I like to wait till a year to make sure that all the fat is really stabilized to a significant degree, and that it's not just revolumizing a little bit later on. And there's a little bit longer downtime, so that can be a challenge for people who are very active in work. But it is durable and I think very natural. And then in the later section of this, I was going to talk about coupling this with facelifts and how I approach the male patients. Thank you very much.
Okay, great.